This month, Functional Health Team is very excited to host Dr. Maureen Hughes. She is the 2017 Teacher of the Year for Somaveda Integrated Traditional Therapies. She is a skilled care provider, and as well, she teaches others this process and how to cultivate within the self the four divine states of being: love, compassion, joy, and equanimity. Somaveda Integrated Traditional Therapies is a blend of modern and ancient technologies designed to help clients heal themselves. A foundation of it is Thai Yoga therapy, also known as Nuad Baran. Thai Yoga therapy has many benefits, and it is much different than a massage. Let's talk with Dr. Hughes more about it.
Well, there are as many different styles of Thai yoga therapy, Thai yoga massage, Thai yoga medical massage, Thai yoga. It is all encapsulated by those words. First, let me state that. And there are as many styles as there are practitioners. However, I practice a style known as Somaveda, which was created by a man named Dr. Anthony James. He was the second American ever in history deemed as a master in Thailand of Thai yoga, Thai massage, Thai medical massage, etc.
Okay.
And it is a very traditional system where we are passed on knowledge in a very specific way, and it integrates both the northern and southern styles of Thai yoga. The southern style is it's very strict, and the postures are very much practiced in a way of honoring the body of the client that we're working on. We are definitely grateful to be working with them. But it also mixes in some of what is known as the northern style, which this comes from the Hill tribe people of Thailand. And the Hill tribe people of Thailand work in the fields 16 hours a day, rice paddies, garlic paddies, whatever it might be, and they just need help. And so in the northern style, it's more just mushing a person that you've known your entire life, as opposed to the southern style, which is working on the royalty of Thailand. So it integrates those two methods. Now, that doesn't say much about what it is. But
Sure.
what it does integrate is assisted facilitated stretching.
Yeah.
So we help a client move beyond their natural range of motion, but not too far beyond. I mean, we're not looking to rip a person apart during a session. We're just hoping to give them a little bit more than what they usually would get regarding range of motion. It also involves compression. And so compression is a valuable way to release fascia, to release muscle tissue, to open up the joints and pump synovial fluid. And then we also work under the Chinese tradition of meridians, except in Thai, we call them sen lines. And the sen lines are the energy lines of the body. In traditional Chinese medicine, there are thousands and thousands of these energy lines. And Thai medicine was created for a normal person to be able to learn and do. And so in Thai, there are only 10 energy lines. And we work those 10 energy lines during every session.
So, why did you want to get into this? How did it catch your eye, and how did it find you?
So I started doing yoga in 1999. I started teaching yoga in 2002 upon the prompting of my yoga teacher. And this was before any of the regulatory systems were in place for yoga. I then ended up doing a yoga teacher training because it started becoming required for a lot of the places that I was working. And my teacher had gone to a training, not with my teacher, but with someone else, and came back and did 2 sessions on me. And I was like, oh my goodness, I had no clue that my body could do this, because my range of motion was limited in ways that was, I guess, abnormal. And of course, hindsight's 2020, and I understand why now, but my body could do things that there's no way on the yoga mat that it would do when I asked it to, if that makes sense. And so she was working me in several of the positions that I work my clients in gently, but it was like, I had no idea that my feet could touch my nose. I mean, now 20 years later after practice, my feet and my nose connect pretty easily. But back then it was a struggle, you know? And what she would do is just like say, relax. And then she would push my feet towards my nose and they touched. And I was like, oh my gosh, I don't think I've done that since I was like 2 years old. But it gave me hope, because even though my perceived limitations in my body were there, what she showed me is that I do have the ability to do so much more. And then not only is that about the body, but it's also about the mind too, because we set constraints upon our mind all the time. Sure. And so the way that our body begins to open up, our mind begins to open up, and traditional Thai medicine also has a lot to do with spirituality as well, especially when it comes to Buddhism and the philosophy of the middle path.
Uh-huh. So one thing I'm really excited about is, and trying to encourage more of, I have to be honest, is in the academies that we run, is more of the hands-on demos. You know, last month we had some smoothies to hand out to everyone, and then that was very tasty. And this certainly, being bodywork, seems like a really cool opportunity to do some hands-on. And you had mentioned that you're interested in doing that, so that makes me wonder then, is it exclusively for a trained therapist, and is there a comparison between this and other types of body work that we might be more familiar with? Is that even fair to compare them like that?
Okay, so that's about 5 questions. So I'll start with saying that anybody can do this. A 5-year-old can do this. A 95-year-old can do this. The whole idea is, what is different about Thai yoga, Thai massage, etc., is that the techniques that we use are very natural. They're very obvious. They're many times very gross in nature, as opposed to very nuanced. Does that make sense?
Yeah. Okay.
So even a very unskilled, unexperienced person can do this and have it do exactly what was intended, which is clear the energy in the body. So I'm at about 3,000 hours of practice now. And now my next level will be 30,000 hours, and I plan on making that as well. But even for a person who wants to do this as a hobby or help just a loved one periodically, just the action of doing any of the techniques that I teach in my classes are going to help a person feel a lot better. I've had the opportunity to work with some pretty incredible clients, one of which who had had a brain aneurysm, and his body was stuck like this. Literally could not move his arm. It just really tightened up. Now, granted, it took me about 2 months of seeing him a couple times a week, but by the end of those 2 months, his arm was completely extended and he could wiggle his fingers. So this was literally about bringing range of motion and faculties back to a person. Are all my clients like that? No. Sure. You know, a lot of my clients, they complain about pain in their back, pain in their shoulders, or, you know, some of them are like, I want to lift more weight in the gym. And my trainer says that I need more flexibility so that I could do a lot more of these exercises and build my muscles more efficiently. Will you help me? And I'm like, yes, of course, I'll help you. One of my clients said that she was able to lift 40 pounds more with dumbbells on her bicep curls just from getting Thai yoga. And I'm like, hey, it's going to help everybody in a very different way. And to say that it only helps people on the physical level is incorrect.
All right. Well, very good. I'm very excited for this month's event. Again, we're going to have some hands-on, so that'll be exciting. And it'll be good to see everybody out there.
Well, thanks so much for the invitation to give this presentation, Dr. Matt. I look forward to being with everybody next week.
Yeah, it'll be fun. Bye-bye.
Thanks.